Hi friends! Today we are going to talk about the APGAR score. The APGAR score, named by Virginia APGAR, is one of the very few terms in obstetric and maternity care that is named after a woman, which says a lot. And we can unpack that in another video. So the baby will be given a score by your care provider at 1 minute after birth and 5 minutes after birth. This score helps them identify if your baby is in need for further support, and it basically helps them identify how well the baby is transitioning. If the 5-minute score is low, typically below 6, the provider will give the baby another score at 10 minutes. So APGAR is looking for 5 different things. So A stands for activity, which is the tone of your baby. So when your baby comes out, if they are squeezing their arms together, they're squeezing their legs to their belly, they're clearly responsive, they're not like floppy, that means that they have good activity. The next is pulse, which is the heart rate. So they're looking for the baby's heart rate to be within a certain range. Grimace is responsiveness, so how well the baby responds to outside stimulation. A is appearance, meaning how well the baby is pinking up after birth, and this can be a sign that the baby is assimilating oxygen well. And R is for respiration, so they're looking for baby's respiration rates to be within a range of normal. So the baby can receive 2 points for each score, with 10 points being a perfect score. Rarely do I ever see a baby actually having a 10, and the reason why is because appearance is often not given 2 points but 1 point. And that's because 2 points typically means that the baby is pink in their belly and chest and in their extremities. But babies are typically not pink in their extremities immediately after birth, and that's because it can take a little while for their circulation system to be established as they get used to taking in oxygen from the air. So baby's skin having a pink tone all over their chest and their belly is a really good sign, and it is also normal for their hands and their toes to be a little more purpley or to just be less pink than their belly and chest. So a perfectly healthy baby who is transitioning so well may receive a 9, and that is totally fine. And even if babies receive a score that is lower, that doesn't mean anything bad is happening. Sometimes babies are born a little more floppy or a little less pink or with a little less tone. And often that means that they just need a little bit of support, or they just need a few moments to kind of come around on their own. Most of the time when babies are born, they just need skin to skin with the person who birthed them. Hearing their voice and receiving some stimulation, like rubbing their back gently, is often all that it takes for babies to come around who are born with a little less tone or who are taking a little bit to cry. It is only very, very rarely that a provider really needs to separate a baby to give them the support that they need to be okay. I do believe that babies are separated far too often. I do believe that babies are rubbed and stimulated after birth far too often. Most of the time, it is not biologically normal for babies to receive significant amounts of stimulation and rubbing the vernix off of them and suction and all this stuff. Stimulation and suction and other tools can be used for babies with low APGAR scores that genuinely need support, but it is not necessary to do to all babies. So some providers might look at the APGAR score and they'll say, okay, if a baby is at a certain number, let's say the baby is a 6, I'm going to step in and intervene. The baby might need some suction, they might need some stimulation, they might need some help opening their airway. Maybe the baby will need a few puffs of air from an ambu bag just to help kind of open their airway and get them to breathe on their own. These things can be done most of the time in the mom's arms. So there are many providers, often midwives, who have more of a hands-off approach, who will look at the APGAR score and they'll step in as needed. And they'll start going through the sequence of NRP, which is neonatal resuscitation. Then there are providers who automatically do suction and rubbing in some of those initial steps of NRP, even if a baby is a 9. And that's just not necessary. Okay, so let's go deeper into what all of these actually mean. So with activity, this refers to the movement that the babies make initially after they're born. So when a baby is born, they'll often squeeze their arms towards their body, they'll close their fists, or they'll move their limbs around a little bit. So a baby that has strong tone will be moving their limbs, pulling their arms to their chest, and a baby whose tone is not so good will be more floppy, meaning their arms are kind of hanging and they're not really curling them into their body. Some babies appear to have moderate tone, which means that they may be a little floppy to begin with, but they start to show more stronger tone pretty quickly after birth. So they might show some mild movement. And in that case, they would probably receive a score of 1. So the pulse is the baby's heart rate. And a normal heart rate for a newborn is 110 to 160. So birth is a natural hypoxic event, meaning that babies are able to tolerate a certain amount of oxygen deprivation as they're being born. They have the system in order to be able to tolerate it, and it is normal up to a certain degree. So this means that when the baby is coming into the vaginal canal, when they're being squeezed during a contraction, their heart rate can drop a little bit. But as long as it stays within the range of normal, it is perfectly fine. It is only when the heart rate begins to drop below the range of normal that it can start to be concerning, and there may be steps that need to be taken to help get baby out faster. And sometimes just a simple position change is really all it takes to help baby get more oxygen and be able to tolerate labor well. Because babies tend to not tolerate labor as well in certain positions that compress the pelvis in a non-optimal way, like lying on your back. Being in upright positions allows for more oxygenation to go to baby, which helps them be more oxygenated and have better heart tones. Some care providers want to reach in immediately after the baby's born and put the stethoscope on the baby's chest and listen to their heart rate to get that number to give them the score. Other care providers will look at the baby first and just assess if the baby seems to be doing okay. If the baby is crying and they're pink and they have strong tone, chances are their heart is beating. So I'm sorry, but getting a number for your chart is not worth interrupting and intervening when someone is meeting their baby for the first time. That's a bunch of baloney. So only when a baby is not looking good, meaning they maybe don't have very good tone, maybe they're not breathing yet and it looks like they're struggling a little bit, maybe their color isn't very pink, that is when it is ideal to step in, to listen to heart tones, to listen to respirations, trying to understand what the baby is struggling with, and to start going through that sequence of neonatal resuscitation, which involves listening to the baby's heart rate. Other care providers, if they find it's necessary, or if they start to kind of go into that neonatal resuscitation pathway, they can put something on the baby's either right wrist or left foot called a pulse oximeter. And that's just a little device that tells them what the baby's oxygen saturation is and what their heart rate is. Baby's oxygen levels are normally low after birth. So you might see that a baby has the number 80 or something for oxygen. And that can be really terrifying to see. But the truth is that it's actually within the range of normal for the first 10 minutes for a baby's oxygen levels to be considered low for adults, because the baby's circulation system is establishing and they're working on taking in oxygen from the air. And they have a biological system worked into their process of transitioning into life that allows for them to be okay while having lower oxygen saturations. So when they do a heart tone check, if the baby's heart tones are within the normal range, they will receive a score of 2. And so just to give you an idea of what oxygen saturation looks like, that is normal for a baby, this is what the American Heart Association has to say. So 60 to 65% is normal at 1 minute, 65 to 70% is normal at 2 minutes, 80 to 85 at 5 minutes, and 89 to 95 at 10 minutes. If it's slightly below normal range, they're often going to receive a score of 1, and if they're way below normal range, they will receive a score of 0. So next is grimace, and this refers to the responsiveness of baby after they're born. So sometimes babies show grimace by sneezing or coughing or responding, to stimulation. If you were to touch a baby's foot, they would show grimace by curling in their toes. If you were to touch a baby's palm, they may show grimace by wrapping their hand around your finger. If you don't want care providers touching your baby unless necessary, that's okay. They don't need to touch your baby to assess grimace. This is something that they're able to witness themselves as the baby is responding to being held by you. So if the baby has a strong response to stimulation, they'll probably receive a score of 2. And if their response is weak but present, then they'll probably receive a score of 1. And if they are not showing any grimace, the score will be 0. And so next is appearance, which refers to the baby's skin color after birth. So they're specifically looking for the range from gray to pink. So babies of any race, of any ethnicity, will show some pinkness to their skin, which means that they're assimilating oxygen well, that they're well oxygenated, and they're transitioning well. And it's really important that you're birthing with a care provider who knows how to assess the color of a baby's skin, looking for the pinkness that shows them that the baby is receiving adequate oxygen to any race or ethnicity. Black and brown babies are more likely to be seen as not having the pinkness that they need because care providers who are not trained properly may not be able to identify the pinkness in babies of other skin tones outside of babies that are white. So this may lead a care provider to inappropriately respond to what they are seeing because they just don't know how to assess correctly. This is why having more Black and brown midwives available to support birthing families who are also Black and brown is one of the best ways to improve the maternal and fetal healthcare outcomes in our country. And to have care providers who are trained properly in assessing all kinds of babies, because that's their fucking job. If you want to learn more about how to protect yourself against systemic racism in pregnancy and birth, there is a link below that you can click on that will give you a list of some resources. So if your whole baby is pink, including hands and feet, then they will receive a score of 2. It's very unlikely that their hands and feet will be pink. So if their hands and feet are not pink, but the rest of their body is, then they will receive a score of 1. If the baby is gray or purple, they're not turning the color that they want to see, the baby will be given a score of 0. And next is respiration. So all babies have amniotic fluid in their lungs. When they're born, they move through the vaginal canal. There is a squeezing that happens, and when their head emerges and they're squeezed, this can help to facilitate squeezing out and releasing the amniotic fluid from their lungs in preparation for them to breathe in oxygen. Once the baby is born, they may take a few moments to work out that fluid and to start breathing on their own, and that's okay. And this is why delayed cord clamping is so important, because it's giving babies some protection as they're making that transition to taking in oxygen from the air. A normal respiration rate is 30 to 60 breaths per minute. So to identify respiration, a care provider can place their hand on the baby's abdomen and count each time the baby lifts their abdomen up, or they can listen to respiration rates using a stethoscope. It is more ideal to listen to respiration rates until they know that the baby's lungs are clear, because it's important to be aware of any crackling noises that they may be hearing in the lungs, which just indicates that the baby is still working fluid out. If the baby is attempting to breathe but they're not able to because of something blocking their airway, they may do something called retractions. A retraction is when they try to breathe, and so the abdomen starts to kind of suck in around the ribs, which shows that they're making effort to breathe, but they're not actually taking breaths. Their chest isn't rising in the ways that ours would when we take breaths. Instead, their belly is kind of sucking in around their ribs, exposing their ribs. Signs that a baby is breathing normally include a rising of their abdomen and chest as they breathe, a normal respiration rate and taking breaths without retractions, and a pink tone to their skin. So if baby's respiration rate is normal, they'll be given a score of 2. If the respiration rate is slightly above or below, then they will be given a score of 1. If the respiration rate is absent, they will be given a score of 0. As I said before, if a baby is born and it appears that they're breathing well, there is no need to go listen to breaths immediately after birth. It's okay to give parents a few moments to see their baby and to meet their baby without a bunch of other people in the mix touching the baby. It is only when the baby is not showing respiratory effort or it looks like they're struggling that it is actually necessary for a provider to step in. Thanks so much for listening, and I hope this helps.